Hello, listener, and welcome to the Southern 7 podcast. I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy, and is recorded at our main offices in Olin, Illinois. Southern 7 Health Department and Head Start serves the lower 7 counties of Illinois with public health clinic offices and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend and make sure to check out our other podcasts on the Southern 7 app, on Spotify, and through our website at southern7.org. Well, listener, we often talk about cancer here at Southern 7 and doing all you can to prevent it, like screening for colon cancer or taking a genetic cancer test. But when it comes to liver cancer, there's no screening for that. But you can prevent Hepatitis B Virus, or HBV, from causing liver cancer by simply getting vaccinated. In today's episode, we're going to Zoom chat all the way to Chicago to talk with one of our partners in our HBV program here at Southern 7 to find out what you need to do to check your hepatitis B status and where you can get vaccinated if needed. So stay right here. We'll be back in a moment.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Genetic cancer testing looks for genetic cancer mutations in your DNA, which could determine your risk of developing breast, colorectal, ovarian, prostate, gastric, melanoma, pancreatic, and uterine cancer. To learn more about genetic cancer testing and the ovarian cancer programs through Southern 7 Health Department, just call
634-2297.
Welcome back to the Southern 7 podcast. Joining me today is Alia Southworth. She is the Senior Program Director in Health Programming. Did I say I've messed up your title completely? Tell us who you are, Alia, and tell us what you do there.
Yes, absolutely. Thanks, Shauna. So my name is Alia Southworth. I am our Senior Program Director of Health Promotions at Asian Health Coalition and the Center for Advancing Health Equity in Rural and Urban Communities through the University of Chicago Medicine and Penn State University.
Okay, so see, it was a whole mouthful anyway, so I was okay that I messed it up. That's okay.
Yes, I mess it up often.
Okay, very good. But I do know you. We've been working with you for a while now on a program that we have here at the Health Department. And we're going to talk about that in today's podcast. But first off, tell us a little bit about where you are and what you do there and why all that you do is so important.
Yeah, so Asian Health Coalition, we are located in Chicago. However, we serve everybody. We serve the whole state of Illinois and even have expanded recently to national. And what we really do is work to provide health education and programs to communities that are maybe underserved. So we have really, started with Asian communities, but we've recently, in the past, decade or so, expanded to reaching those, other minorities and really the rural communities, which is what brings us to working with Southern 7 and, doing the great work that we do there. And so we have a lot of different health programs that we cover, and I believe today we're actually talking about hepatitis B.
Right, exactly. Yes, hepatitis B. But yeah, again, you all do so much, and we partner with you on a couple of other different programs here at the Health Department. So first, I want to say thank you on behalf of Southern 7 and, all of us here for the great partnership that we have with the University of Chicago and the Asian Health Equity, with everyone, because you help keep us going and you bring a lot of great programs to our region. So thank you so much. We do appreciate that. So yeah, today we're going to be focusing on, though, hepatitis B, which is one of several programs we have, but that's the program that we're going to focus on. And in talking about the hepatitis B virus, what people can do in order to be vaccinated if needed, get tested if needed, but basically just bringing those numbers down and getting individuals back to a healthy state. So in terms of looking at why Southern 7 was chosen to receive this funding. And again, the funding also comes through the Hope Light Foundation as well as a partnership that we have with University of Chicago Medicine, Asian Health Equity, as well as the Hope Light Foundation. But why is it so important for Southern Illinois? How did you choose Southern Illinois to do this?
Yeah, so it's important for Southern Illinois really because of the rural communities you serve and to really get the word out there. So, with hepatitis B, it's something that impacts everybody, and so we really wanted to, working with Southern 7, being able to disseminate that hepatitis B prevention information to these populations, many who could be high risk, and wanting to just let them know that this is something that it is preventable, and that they can test for easily. And so just really working with Southern 7 to get the word out there to communities that we otherwise wouldn't be able to, reach with this really important information.
Exactly. And this is the 4th year that we're presenting this. I'm really excited about that. It's gone over very well in our department here, and we're also expanding it with Penn State University, correct?
Yes. So with Penn State University, we have recently expanded there to create our Center for Advancing Health Equity in Rural and Urban Communities. So we're very excited on that expansion.
Great. So all this ties together to make sure that the people who live in the Southern 7 counties in Illinois are getting the services that they need, including hepatitis B prevention. Now, we've been doing this now for a few years, and I'm sure you were even looking at our region prior to this. Why is HBV testing so important here? Do we have a higher rate than other areas? What are you seeing there?
So it's important because, hepatitis B is really considered almost like a silent killer or a silent disease, where many don't know or realize that they have it, or have been exposed until it's already, impacting their liver. And so, in terms of why Southern 7, it's really, again, just going back to reaching these communities that may not get this information. So testing is, highly important. There are certain populations, it can be spread, mother to child at birth is the main one, but also through, injection drugs and being born from high endemic countries. And so what's really important about being tested is that just hepatitis B is one of the only preventable cancers almost, because hepatitis B can lead to liver cancer, but there is a very safe and effective vaccine. However, despite this, it's estimated at 1.4 million, but experts say it's probably 2.4 million in the United States that have hepatitis B. And it can be left unmanaged. A lot of people don't realize that, they have it because there often are no symptoms. And so it just really comes to, testing is important. To be aware and know your status.
Well, like you said, it does help to prevent liver cancer. And, we're constantly talking down here in our region about the high rates of cancer that we see in the lower 7 counties, whether it's colorectal cancer or what it may be. But we do overall see those higher rates here for whatever reason. So this is, like you said, it's just another way for people to get that prevention, to get on top of any cancer problem that they might have. So, 2.4 million people, that's quite a bit. that is frightening.
Only about 25% of those that are infected are actually diagnosed with hepatitis B. So that's why that testing is so important, because there's a large part of the population, or a large part of those who may be infected and just they don't know because they're not getting tested.
Now, in looking at who should get tested, who are we talking about here predominantly? Are we looking at an overall group of people?
Yeah, so actually last year, the CDC released new recommendations that all adults 18 and older should get tested for hepatitis B at least once in their lifetime. Um, when you do kind of look down at it, the most common way to get hepatitis B is from mother to child at birth. And so, all pregnant women should be tested for hepatitis B during every pregnancy. Other high-risk populations include individuals who use or formerly used injection drugs, and then those who were born or their parents were born in high endemic countries. And that's primarily, we're thinking of, the Asian and African countries at that point. And then the last, kind of high risk group in there are men who have sex with men. But it's a simple blood test. And really it comes down to, the CDC recommends that everyone should get tested at least once in their lifetime.
Now, the vaccine for hepatitis B is something that's been pretty standard in about the last, 20, 25 years? I mean, do we know when that started?
Yeah, so the vaccine was administered actually in the early 90s.
Okay.
And so it's been, closer to 30, 35.
Yeah.
Right?
Mm-hmm.
And so it is a very safe and effective vaccine. Many who are born in the United States actually will get that vaccine at birth, at least their first initial dose. However, you can get the vaccine at any time. So if you were born, after 1990, I think it's 1992, you can still get the safe and effective vaccine.
So how does the vaccine series work? Because it is more than one, correct?
Yes. So the typical vaccines that are there, and I believe this is the one the Southern 7 Health Department provides as well, is the 3-dose vaccine. So you receive the first dose at, kind of time 0, whether that be a birth dose or, your just first dose as an adult. And then you receive another dose 1 month later, and then your final dose at 6 months past that. With hepatitis B vaccine, however, once you are vaccinated and receive those 3 doses, you will not need to get any more vaccines, ever. You are immune and vaccinated from hepatitis B.
So that's another reason to get tested. If you've already had the vaccine and you just don't have a record of it, you don't want to go through the series again. So
correct.
So that's
yes, and the test will tell you if you've been exposed, if you're vaccinated and immune to it, or if you have hepatitis B.
Okay. And we want our listener to know that Southern 7 Health Department does not test for hepatitis B. We do vaccinate. So if you contact, our offices, we will direct you to your healthcare provider and to get that test done, or another clinic in our area. But then if it turns out that you need it and they're not able to provide the vaccine, we can provide that for you. So we just want people to know that, right off the start, because people do ask us that quite a bit. So let's talk a little bit about the symptoms of HBV. Tell us about those. Are there really?
Yeah, so what's most important is there really is not any symptoms of hepatitis B. Most people do not feel sick. And once they start to develop symptoms, it's usually when their liver damage has already occurred. And so that's the scarring of their liver, cirrhosis. And so yeah, there really is no telltale sign of, hepatitis B.
So this may be a dumb question, but I'm going to ask it anyway, because somebody else may be thinking it too. Oftentimes you hear that people get cirrhosis of the liver from overuse of alcohol, which that is part of that. But sometimes you hear about the non-alcoholic cirrhosis. Is that where this comes from, or do you know, or is that just something totally unrelated?
No, so that's different. So hepatitis in itself, if you break down the word hepatitis, is a virus of the liver. And so the non-fatty, liver disease and those, cirrhosis and things, that is completely separate from hepatitis B. So hepatitis B does impact your, liver. It can cause that scarring or cirrhosis. And so tying back to what you were asking, if you have hepatitis B and then do drink alcohol or have, kind of some of these other things that can impact the liver, it can make it worse. But there is no connection between hepatitis B, alcohol, and kind of the liver, the non-fatty liver cirrhosis.
Okay, we get asked that too, so that's why why I wanted to go ahead.
Absolutely.
I need an expert to explain that, so thank you very much. Is there treatment for HBV? I mean, what can folks do there if they test positive?
Absolutely. So if you test positive, you can still live a long, healthy life, still have children. There is currently no cure for hepatitis B. They're working on it, but there's no cure yet. However, they have, there's treatment plans. So if you are tested positive, what you would do is work with your provider. They will determine if you need to, go on a medication really to keep what we call your viral load. So how much of that virus is in your system to keep that down so that you're less likely to kind of spread it to others. But you're able to live a long, full and normal life with, just a few extra doctor appointments in there to make sure that, you're doing okay.
And again, we want people to realize this is a bloodborne virus, not an airborne in any stretch. I mean, that the only way they're going to get it is through blood to blood contact, correct?
Correct. So it is primarily bloodborne, and also it can be transmitted through, sexual fluids, but not saliva, not airborne.
Okay, good. We want to make sure that we cover that. Okay, great. Well, we have covered a lot of wonderful information here. Is there anything else that you want to add to this, Alia, that we've not talked about yet?
Yeah, that it's important to know your status and, to know also your family's status and get vaccinated. It's highly preventative at, preventing hepatitis B and that, hepatitis B is something that isn't stigmatized. It shouldn't be stigmatized, that I guess I should say. It's important to be tested. It's a simple blood test. You can actually, next time you're going to your doctor, ask them, hey, have I been screened, or can you add on that blood test? We like to say, just add Hep B so that your status and can, be safe and protected and have your family safe and protected.
Great. So yeah, just make that part of your regular next check and you're good to go. Right?
Yes.
All right. Well, Alia, thank you so much for being with us on our podcast today. I do appreciate it. It's wonderful to have you on here. I've been excited about doing this with you for a while. And thank you again for being part of the team here at Southern 7, because I do consider you guys a partner, a team member, everything here, because we couldn't do this without you guys. So thank you so much for all of it.
Thank you, Shauna, for inviting us and for all the hard work that you do.
Well, thank you.
All right, listener. Well, that wraps up this episode of the Southern 7 podcast. Thank you so much for joining us. We also want to thank our guest today, who is Alia Southworth. Once again, she is the Senior Program Director of Health Promotion at the Asian Health Coalition at the University of Chicago and Penn State. So thanks again, Alia. All right, listener, if you like today's podcast, please make sure that you share it with a friend. Also, make sure that you listen to all our other podcasts. You can download us on the Southern 7 app. Listen at southern7.org. You can also check us out on Spotify and on the Southern 7 YouTube channel. For more information about programs here at Southern 7 Health Department, give us a call at 618-634-2297. And also, make sure you follow us on social media. We're on Facebook, Instagram, Twitter. Make sure you check us out. From all of us here at Southern 7 Health Department, we wish you a wonderful day.